For 4 days, representatives of the federal government, development partners in the health sector, and networks of people living with HIV and AIDS converge on this hall to celebrate the 2016 World AIDS Day in Abuja. The Director General of the National Agency for the Control of AIDS gives the current status of the virus and the challenges he faces trying to control its spread.
Almost 1 in 10 people living with HIV globally are in Nigeria. About 600 people acquire the infection every day in our country. Now is the time to tackle the challenges of inadequate domestic funding, shrinking donor support, a weak healthcare supporting system, and a poorly coordinated national response.
However, the country director for the United States Center for Disease Control explains how much the American government has invested in treatment and care for HIV in Nigeria.
Nigeria, since 2003, has received almost $4 billion to address HIV prevention, care, and treatment. The results so far are encouraging, but we are not satisfied.
Meanwhile, the secretary of the network of people living with AIDS in Nigeria decries the lack of access to medication by his members.
We have less than 1 million that are under ARV treatment. We have a long way to go. Nigeria accounts for 3.5 million people living with HIV and AIDS in this country. We have to fast-track antiretroviral therapy.
The Minister of Health, represented President Muhammadu Buhari, assures of government's commitment to fund HIV prevention efforts while appealing for prudent use of resources.
I'm aware of the challenges that have arisen in the last few years with regards to the delivery of HIV services in the country. I hereby reaffirm our commitment of ensuring accountability and transparency in the HIV sector.
The minister then proceeded to launch the national guideline for the treatment and control of HIV and AIDS in Nigeria.
As this year's World AIDS Day is marked globally, Nigeria's annual new HIV infection figures have reduced by 54% in about 10 years, from 350,000 in 2006 to about 191,000 in 2015. Good news it seems, though. But there are more hurdles for the country to overcome. These include addressing inadequate funding and lifting barriers of HIV and AIDS prevention and treatment services. Our correspondent, Yomi Otaibe, reports.
The first human immunodeficiency virus, HIV infection, was recorded in Nigeria in 1986. The initial prevalence rate in the year 1991 stood at 1.8%, rising to its highest of 5.8% in 2001, owing to ignorance, fear and other social cultural factors. With improved HIV awareness, counseling and testing, there's been steady decline in the prevalence rate, which now stands at 3% as at 2014. But the country is not out of the woods yet. According to the National Agency for the Control of AIDS, NACA, the current 2015 estimates of people living with HIV in Nigeria is a little above 3 million. 2.25 million of this number need treatment, but only approximately 854,000 people are presently receiving antiretroviral drugs. Linked to this situation is inadequate domestic funding, coupled with declining support from international donor partners.
We can say that the situation is devastating, especially for a person living with HIV and AIDS, because the drug represents life, and the drugs are not there. To compound the situation, for those that are already on treatment, they have been asked to pay for certain services that were free before now.
Mother-to-child transmission of the disease is still a major factor.
We are contributing about 30% of the global burden of pediatric HIV. And what we need to do is to invest more in the elimination of mother-to-child transmission of HIV by ensuring that every pregnant woman is tested for HIV. And those who are positive are taken care of.
90-90-90 is an ambitious treatment target to help end the AIDS epidemic. It indicates that by the year 2020, 90% of all people living with HIV will know their status. 90% of all those diagnosed with HIV will receive sustained antiretroviral therapy, and 90% of all people receiving the drugs will have viral suppression. Nigeria is lagging behind in the attainment of these UNAIDS treatment targets. Clearly, access to HIV treatment is one area in need of improvement. However, addressing stigma and discrimination is also an important key factor in HIV control. Yomi Otaigbe reporting for Channels Television News.